Dr. Hammad Bajwa has a most interesting medical background. He took his medical training at the King Edward Medical College, Lahore, Pakistan. He is a native of Pakistan. Then he went on to come to America, and he attended a residency in internal medicine at Southern Illinois University. From there, he came to the University of Minnesota with a fellowship in rheumatology. And now you're practicing, doctor, in the Arthritis and Rheumatology Consultants program in Edina.
In Edina, right.
So, my question is, welcome, because I'm fascinated with your background. What is a rheumatologist?
So rheumatologists are physicians who practice rheumatology. And in a nutshell, rheumatology is a subspecialty in internal medicine that deals with rheumatic diseases and multiple musculoskeletal diseases. Looking at the literature, there are, I think, over 120 rheumatic and musculoskeletal disorders, and that kind of, overlook the world of rheumatology. And
I think it's time to explain to the viewers how I happened to meet Dr. Bajwa. Well, the fact is that a few months ago, one morning suddenly, I wound up with a condition called polymyalgia rheumatica. It's a sign of aging. What is polymyalgia rheumatica?
Polymyalgia rheumatica is actually a very exclusive disease of elderly people.
I like that. I like exclusivity.
And
I could have done without it, though, frankly.
There are actually few diseases in the world of rheumatology that exclusively happen in older people, and polymyalgia rheumatica is one of them. The other one is temporal arthritis. And both these diseases are actually under the same big umbrella, but they are at different ends of the spectrum. Polymyalgia rheumatica particularly is a disease of elderly where they have stiffness, and this usually comes on suddenly, and no one exactly knows what's the cause. Many things have been hypothesized, but nothing is for sure. But it presents with stiffness in your shoulder girdles and in your hip girdles. So people have a lot of stiffness with activities that involve getting out of chair, for example, raising their hands above their arms, and they have systemic symptoms. So this is a disease which is not just related to muscles, it has a systemic burden. The markers of inflammation in the blood go high, patients have fatigue, they have prolonged morning stiffness, they wake up at night from aches and pains in these particular areas. A lot of times patients have weight loss, which happens few months before the disease present, and generally patients can also have anemia.
I was in terrible shape, and what did you do for me?
Well, polymyalgia rheumatica is actually one of the only diseases in rheumatology in which we give our patient a very low dose prednisone, and most of the times within few hours patients just start feeling better.
Absolutely.
And it seems like a magical cure, and actually this is, I think, the only disease in rheumatology that gives you such an instantaneous relief of symptoms.
As long as I had to have a disease, it's nice that I had this one. Yeah, I see. Earlier you talked about the relationship between geriatrics and rheumatism and so on. We seem to be generally hits the seniors, right? These problems.
Exactly. Well, rheumatology covers almost all age groups, but there are multiple issues with elderly people that are taken care of in a rheumatology clinic. So at any given point, I think a big rheumatology practice has a lot of geriatrics patient, and the concern, I think the issues that happen is that as we age, there are multiple things that happen in human body which are related to musculoskeletal systems, which are dealt by rheumatologists. And going into a little bit of common musculoskeletal issues that happen as we age, I'm sure our audience and people have heard about bursitis, tendinitis, and things called epicondylitis. So these are all musculoskeletal regional problems which happen as we age and the body changes. For example, this is a very common problem. Patients can have bursitis in the shoulders, which is called subacromial bursitis, and particularly that causes impingement kind of syndrome in the shoulder, and they have difficulty raising their arm up. You can also have bursitis in the hip, and that is also a very common problem that I see in practice, and that is the bursitis is on the outer aspect of the hip region, and people have difficult time laying in bed on the sides. As far as tendinitis, it's very common to have hand tendinitis around your wrist. Epicondylitis is another thing that happens, and that is generally known as like a tennis elbow or golfer's elbow.
What are some of the major, I hear the words arthritis, there's a certain type of arthritis that is particularly virulent, rheumatism and so on.
Yeah, there are actually over 100 types of arthritis. Definitely we don't see all 100 types, but there are a lot of common types that we see. The biggest I think the most important distinguish that anyone needs to make is whether this is an inflammatory arthritis or whether this is a non-inflammatory arthritis, which we consider as
rheumatoid arthritis, for example, I hear that word.
So rheumatoid arthritis is an inflammatory arthritis.
So how do you take care of these things on a different basis then, depending whether it's inflammatory or non-inflammatory?
Exactly. It's a big difference in management. It's a big difference in outcomes.
Can they be managed?
They all can be very well managed with the stuff that we have now. Rheumatoid arthritis, if I was to say that if in the world of rheumatology anyone has to have a disease, no one should have a disease, but if anyone has to have a disease, I think it should be rheumatoid arthritis, because we are far more advanced in understanding this disease and we are far more advanced in managing this disease. It is a disease in which the joints are swollen, painful, prolonged morning stiffness, people have fatigue, they wake up at night from aches and pains, and this is a systemic disease. And it not just involves your hands and joints, it can affect multiple joints and it can affect multiple body organs. So it's a systemic disease. So this is an example of a classic inflammatory arthritis.
And it's not necessary to suffer from this anymore, right?
It's not necessary to suffer from it. Actually, you should not suffer from it, because even if you say, I am brave and I can deal with aches and pains, you are doing joint damage. So when you become more older, your joints may have joint damage and they may not work normally, and they may develop deformities. So it's actually very important to treat rheumatoid arthritis very aggressively at the early stages, which is within the first several months of the disease
So when you start getting all these pains and so on, show up at some doctor.
Show up at some doctors and get tested for these conditions. See a rheumatologist to make sure what type of arthritis you have. And just to mention, on the other hand, the osteoarthritis, which is also known as degenerative arthritis, wear and tear arthritis, old age arthritis, is a non-inflammatory arthritis in which, generally from what we know at this time in medical literature, it is a benign course which only involves your joints. So definitely your joints ache, but definitely that disease does not have a systemic burden, does not involve any other organs like rheumatoid arthritis. And there's a lot more that can be done for osteoarthritis nowadays as well.
How about osteoporosis? What's happening with that?
Well, osteoporosis is also a major portion of a rheumatology practice, and osteoporosis is basically what we call weakening of the bones. And what happens overall, if you don't do anything about it, people end up having fractures. And if they have a fall, they'll have a fracture, and that will lead to many more complications. Hip fractures are very common. The spine, the vertebral fractures, compression fractures are very common. And actually, it is very important for people to be tested for osteoporosis screening.
The important thing is this, that whenever a senior appears to have some problems, aches and pains and so on, don't suffer. Immediately see a doctor.
Immediately see a doctor.
In this category of
exactly.
For example, arthritis and rheumatology.
Yep.
Doctor.
Exactly.
Thank you very much. We've been talking to Dr. Hammad Bajwa, and the subject matter concerns our aches and pains. He is with Arthritis and Rheumatology Consultants. Thank you very much, Doctor.
Thank you very much for having me over.